that you get a call from your elderly mother around 2 a.m. who's experiencing chest pain. By the time you arrive at the hospital, the nurse is sitting next to your mom and has already taken her vitals and an EKG and says everything looks fine. You decide to bring her to the emergency room just to make sure everything is okay. When you walk in, you will most likely be greeted by a tech or probably a nurse. The nurse will guide you and your mother to a room, and shortly after you get placed in a room, a nurse will come in and take your mother's vitals and ask her some questions. He or she will ask you questions such as, when did this start? What kind of pain are you feeling? Is it a pressure and ache? Do you have any other symptoms? She answers with nothing out of the ordinary. While earlier the EKG read normal, her blood pressure was a bit elevated. You can tell your mother is very worried. Nurses walk in and out of the room constantly checking in if either of you need anything at all. In the midst of waiting for a doctor, the nurse comes in and sits down to your mother, and they both start talking and have a general conversation about your grandkids. You can see your mother's face look more at ease as she's being comforted by the nurse. After chatting with the nurse, she says it was very nice to meet you and a doctor will be in with you shortly. You both end up waiting a much longer time to follow up with a doctor. The doctor finally comes in and says everything looks perfectly normal. She signs the discharge papers and is out within the next 5 minutes. What percentage of that time did the patient and family spend with an MD versus an RN? According to the National Institute of Health, about 13% of the time is spent with an MD, 8% is spent with the support staff, and the other 86% is spent with a nurse. When you walk into the hospital, you are far more likely to spend time with a nurse than a doctor. The nursing workforce is the largest among all the healthcare professions and is nearly 4 times the size of the physician workforce. That may not seem like a lot, but it really is. This means that there are 3.6 nurses for every doctor. During my experience shadowing in the hospital this whole year, I've almost always been put with a nurse, and that was several months of shadowing. I'm not trying to say nurses rule and doctors drool, but I do want you to understand the different aspects of what nurses do that makes them just as important as a physician. While doctors are diagnosing and prescribing medications, nurses are focusing on the overall well-being of their patients. People may think that a nurse's job is just to go from room to room, do a quick assessment on the patient, chart it, and move on to the next. There's a lot more to it than that. If you've ever been in a hospital, you know that a doctor will come in and visit you maybe once or twice a day for only a few short minutes. Nurses, however, are with the patients from the beginning. They are there throughout their whole journey. Not only are they physically caring for their patients by monitoring their progress and administering medications, but they are also truly listening to their patients' concerns and calming their fears. While with nurses, it is also about personal connections. They spend the most time with their patients and are considered a big support system for the patients and their families. You could even say sometimes a nurse has a harder job than a doctor in a way. Let's go back to the scenario from earlier and say a month later your mother comes back to the hospital complaining of chest pain and has been there for a week. She was moved from the emergency room this time because of an abnormal EKG and was required to stay in the hospital for the next few nights. She came in to the hospital on a Monday, and it was now a Friday afternoon, and was scheduled to be discharged later that day. You came to visit her every day that she had been here and saw how much the nurses were doing to help not only her, but you too. She was improving a bit more every day, and you were so excited to take her back home to her husband and grandkids. The nurses working the day shift that afternoon were very excited she was being discharged and decided to throw a small celebration to celebrate. Once you arrive to take her home, the nurses guide you and her to her room and immediately start connecting with you and your family. On the way up, the nurses were talking about how she was such a sweet lady and how they are going to miss her very much. Then all of a sudden, there was a code blue, and it turned out to be your mother's room. She went into cardiac arrest. Nurses helped perform CPR for 15 minutes, but the team couldn't get a pulse back. You were devastated and couldn't believe what had happened after being by her side the day before and seeing how much she had improved. The nurses are heartbroken while gathering her things. They sit down next to you and your family and hold your hand as a form of comfort while the doctors, after a short visit, must move on to taking care of their next patient. After feeling so connected with patients that they've been taking care of for weeks, something unexpected like that can happen, and it can be very hard for a nurse to lose one of her patients, let alone talk to their families about it. Nurses often take on that role of caring for the whole family and not just the patient. Because both nurses and physicians are important parts of the same system, there is said to be an unspoken hierarchy in the hospital. This hierarchy has been around for a very long time, beginning when all doctors were male and all nurses were female. Although gender balance has changed, There are still typically a stated or unstated system where physicians are at the top and a whole bunch of nurses and techs at the bottom. This immediately creates potential places for conflict between nurses and physicians. For example, a nurse may disagree with the treatment or medication for a patient, as they may feel they spend the most time with the patient, and they know the patient better and can predict a positive or negative response more accurately than a physician who may just have come on the shift to meet the patient for the first time. Lots of the time, a nurse's opinion will be brushed over or ignored because the physician feels that he or she is at the top of the pyramid because it is the physician who has the highest level of education, and it is the physician who makes the key decisions about a patient's medical diagnosis and treatment, and will be sued if they make an error. As such, the physician always ends up telling the nurses what to do, even though they are not officially the direct supervisors of nurses. In a perfect world, a nurse should be able to work alongside a physician and be able to bounce their ideas off of each other. And in many places, this is indeed starting to happen. If nurses and physicians are able to work together, the idea of a hierarchy should continue to fade even more, helping nurses achieve their rightful place as important members in the team of healthcare providers. Nurses aren't physicians, and that's a good thing. They take on different roles that are just as important as physicians. They focus to directly care for patients and support them throughout their whole medical and most difficult times of their life. Having a special connection with their patients is what makes nursing most important. Thank you.